Good morning, Sean Thompson here from Australian Imaging. Today we're at KALO Dental in Carlton. We're here to have a chat with Dr. Peter Bakouris and have a look at the case of the week. Let's go down and say hi. Beautiful looking practice, designed and built by Perfect Practice. This practice is using the OP3D, cone beam CT. This is set up as an OPG with lateral ceph and cone beam CT. Great system. Dr. Bakouris, how are you?
I'm good, how are you?
Good. How's everything going?
Everything's well.
Good. How long have you been set up here for?
We've been here for about a year and a half.
Fantastic. And how's business going?
It's good.
It's good. And I noticed you've got a few different KALO products in the practice. You've got the KALO Focus and also the KALO Scan Exam.
We do. Yes.
All performing well?
They're all going great.
Wonderful.
Big fan of them.
Wonderful. We're here to have a look at your case of the week using the OP3D. Can you run us through it?
Sure. We've got a really good case here with a CT scan. So basically it's a patient who had an endo treated quite well by another dentist. The patient was a dentist themselves as well. And as you can see, the dentist has found really well all 4 canals, even an MB2, and navigated and treated them quite well. A few months of pain after the case, and this particular case they couldn't work out what was going on, so they went back in, opened the tooth up, removed the distobuccal canal, and probably about 7 or 8 sets of PAs later, they still couldn't work out what was going on. So basically we got the patient and the dentist in, we took a CT scan, their colleagues and friends, and what that found is just off a quick CT scan, just 2 teeth in that CT, you could see that it wasn't actually a case of anything to do with the root canal or anything missed. The dentist had done a great job. It was actually resorption, external resorption on the distobuccal root, and that got picked up quite well there on CT scans. So we've got the ability in that CT to literally walk all the way through the roots in profile, and you can almost see where that 7's roots are almost dissolving and degrading the integrity of the distobuccal wall. So until we did the CT scan, they really were sort of at odds end with what's going on in that case. So it's quite clear that what the issue is, what the treatment is, and it's a really, really good case at working out, a definitive answer where we might have sort of gone around in circles beforehand.
Yeah, so that didn't take long to be able to diagnose the problem straight away with the CT?
Maybe 7 or 8 minutes.
Yeah, and that was that a small field of view, like a 5x5?
Yeah, just a very small field of view. There's literally 2 teeth in that field of view. There's a 6 and a 7 in it.
Yeah.
And it's on the high quality setting, so you've got really good quality view.
Fantastic. And how often are you using the system?
I'm using it, could be saying, multiple times a week at the moment.
Right. And obviously OPG and ceph is your bread and butter from a day-to-day survey.
We use it quite a lot. Yeah.
Fantastic. Thanks so much for sharing. The practice looks magnificent, and love having you as a client.